Hi guys, my name is Marvelous Akimu and I'm currently a third year medical student of Delta State University. Are you just tuning in for the first time? Do want to hit the subscribe button and ensure you like this video and share to everyone who needs this video. And to my returning subscribers, thank you for tuning in. Alright, so in this video I am going to be addressing medical students, especially those in the embryonic stage of medicine. Okay, so did you just transit from 100 level to 200 level? Congratulations and welcome to Preclinical. And you are a bit confused and you're like, oh my god, what is happening? What is this? Yes, we were once in that shoe. Okay, and so in this video I'm going to be giving some advice I feel will help you as a 200 level medical student. Alright, the first one is understanding the weight of preclinical. Okay, so there's no doubt there that you were so good in your biology, chemistry and physics, but one thing you must take note of is that understanding the weight of preclinical really solves some of your problem, because it actually tells you where you are. Okay, so if you are coming to preclinical with the mindset of, oh, I will just relate anatomy as biology, relate biochemistry as chemistry, then you must be joking, honestly. So try as much as possible to get an idea of the weight, because trust me, preclinical is bulky compared to where you were coming from, your general sciences, physics, chemistry, biology. And secondly is anatomy is unique. Respect anatomy. As funny as it is, anatomy is so unique. It is unique in the sense that it is divided into three components. So we have under anatomy, gross anatomy, embryology and histology. Unlike physiology and medical biochemistry, which is just a course on its own, but you see anatomy, you have three sub courses under anatomy. So this means that anatomy is quite bulky than the rest of them. So having this at the back of your mind helps you to plan your study and also helps you to approach each of those courses when it's time for you to read. I want to say, why should I have respect for anatomy? Why should I have respect for anatomy? See, anatomy is one course that you will never find it relatable. Alright, maybe you might find it relatable in osteology parts and probably when they are mentioning some organs, maybe liver. Okay, you did liver in biology, but trust me, knowing liver is not just the thing. Alright, knowing liver is not just it. But you see physiology and MBC, you will find a lot of things very relatable, a lot of things. You'll be seeing mitochondria in physiology, lysosomes, all those things you did in secondary school and also in your 100 level, you see. But anatomy is a different ball game. In fact, anatomy is like learning a language and it has its own terminologies. That's the worst part of it all. It has its own terminologies. This is why you must, before you start reading anatomy, ensure you learn these terminologies. You have medial, lateral, inferior, superior, all these things, because that is the terms that will be used in your textbook. And so if you don't have a good foundation of these terms, when you start reading in your textbook, you will see that you have issues. And trust me, this step cannot be skipped, because if you skip this step, you are just playing with your med school. You are playing with your results in med school, because at the end of the day, you will just end up cramming. And the question is, how many things do you want to cram? Then the next one is, don't neglect physiology. So over the years, there's this kind of pattern that happens in medical school, that students eventually get carried away because anatomy is so bulky and you just see them, they keep on reading anatomy, and you see this particular person, Monday anatomy, Tuesday anatomy, Wednesday anatomy, Thursday anatomy. Trust me, the person might be reading the three courses, alright, but the person is still under anatomy. So what am I trying to say in essence is, Monday you might read embryology, Tuesday histology, Wednesday gross, but trust me, those 3 days you were still reading anatomy. So because of this complexity and bulkiness of anatomy, people tend to prioritize anatomy the more and neglect physiology, because physiology is kind of very relatable. Trust me, physiology is very relatable. when you start reading physiology, you see that yes, truly it's relatable. And so because of this relatability, many people will leave physiology and be like, oh, physiology, I can just crash read physiology. But trust me, physiology will shock you, right? So at this early stage, don't neglect physiology. In fact, don't neglect any course, carry every one of them along. Then the next one is biochemistry is not irrelevant. Biochemistry is not irrelevant. I really don't know who started this trend or the generation it started, but it was passed down to me, sha. But I would like to tell you that biochemistry is not irrelevant. In fact, there is no course you will do in med school that is irrelevant. Each of them have their role to play. So just imagine anatomy dealing with structures, physiology dealing with the functions, and you might want to ask that, okay, what exactly is biochemistry all about? Now, if you have started reading, you will see that at the end of each of the topics, there's always an applied aspect. Okay, so when you read your anatomy, you see there's an applied anatomy. When you read your physiology, there's an applied physiology and stuff like that. Now, one thing you must take note is that most of these applied concepts are relatable with biochemistry. They are very related because biochemistry just tells you everything that happens in cellular level. Alright, so you have headache now. It is your head that is paining you, or it is one part that is paining you. There is surely a biochemical basis of that pain, and so it's very it's an interesting course, no doubt. It's an interesting course. So don't enter med school with the mindset of biochemistry is very irrelevant, because trust me, it will give you a very tough time, because you will meet a lot of pathways and just be like, what is the usefulness of this pathway? When I started, it was the same question I asked. I was like, how do I do this pathway to treat a patient? But eventually I realized that in all of these pathways, there's a step in the pathway which is known as the regulatory step, that's controlled by an enzyme, and a deficiency in this enzyme can lead to something. So that something has symptoms. All right, so if you just look at someone and you see this kind of symptoms, you can just relate it that, oh, it is probably because this enzyme is deficient. What's that? Biochemistry. It is not physiology, neither is it anatomy. So biochemistry is very relevant. Then the next is learn how to read smart. Learn how to read smart. Trust me, med school will make you feel like you don't know what you are doing. Okay, so you might have been the best in your secondary school, in your primary school, in fact in your 100 level days, and now you're in 200 level. It's a different ball game. So learn to read smart. What exactly is reading smart? Just in case you don't know what reading smart is, do well to indicate in the comment section so I can make a separate video on how to read smart as a medical student. But basically what reading smart is all about is prioritizing important things. And now the question is, what exactly are important things? It will be so surprising that part of reading smart is attending lectures. So just in case you want to know more about reading smart, do well to indicate in the comment section so I can create a separate video on that. This video is specifically for the advice, alright? So if you need a separate video on how to study smart as a medical student, let me know in the comment section. Then the sixth advice is study group is a weapon. Oh my god. In fact, study group has really helped me a lot. I no doubt it has really helped me. So I know many of us are like, oh, I am a loner. Alright, I read alone. I love reading alone. When I read alone, I used to understand very well. When I read with people, I don't used to understand. One thing you must take note of is that medicine is teamwork, and there are a lot of things you will learn in medicine, not because you knew how to do them before, but just because of how essential they are. Okay, so once upon a time, I was never a night reader, but to the glory of God, I can read in the night now. Okay, that is because of the state, or that is because of the circumstances I've found myself. So you don't know the circumstance you'll be in tomorrow, but trust me, having a study group is really a weapon because it helps you read more faster than reading alone. So you guys gather together, and this one talks about this concept, this one talks about this concept. Yeah, occasions where I go for an exam and I don't even remember what I read, but what somebody discussed, I'll be like, oh, this person actually talked about this thing, and I just put down something to write. Eventually it comes out good. So having a study group is very important. But one thing you must take note of is that while study group has its advantage, it also have a disadvantage, because if you make study group with people that are very unserious, trust me, you will be unserious too. So while forming a study group, you should form study group with serious minded people. Alright, so the seventh advice is learn the act of spotting. Alright, so what exactly is this spotting? You can actually look at an organ, a tissue, or whatsoever, and tell a lot about that particular thing you have looked at. That's what spotting is. So you might want to ask, what is the importance of this? So there's a practical based exam in anatomy called steeplechase. So in this steeplechase, you are faced with stations depending on the choice of your school. So some schools have 20 stations, 30 stations, 50 stations, depending on the choice of your school. So in each of these stations, things have been placed. So you see organs, you see tissue, you see a lot of things. They just place it there, models, and you just need to look at it and answer the question there within a time frame, very short time frame. Some schools 30 seconds, some schools 1 minute. But trust me, if you don't master the act of spotting while reading, then you will not be able to do well in that examination, because that examination is all about being fast. All right, so you just look at a bone, for example, and you can tell, oh, this bone is left or right, and you can also tell the ossification of the bone. You can also tell a lot of things about the bone just in seconds. Okay, so while you are studying, you should take note of all these important facts. All right, try to go through atlases over and over and over and over and over and again. It gives you the confidence. So you look at a particular organ, maybe the heart, and you can tell, oh, this is part of the heart that has been pinned, or this is the artery, or this is the vein, and you are good to go. Alright, so the eighth advice is respect your seniors but think for yourself. Alright, this is med school and not any other thing, and because it is med school, you will need your seniors, because medicine is more like apprenticeship. So those who are ahead of you will definitely, one way or the other, help you. So this respect must be there for your senior colleagues. Alright, but respecting your senior colleague doesn't mean you can't make decisions for yourself, because a lot of things happen in med school, and one of the factors is the fact that students don't really know how to make decisions for themselves. So you receive a lot of advices from senior colleagues. This one will tell you have to finish one course, then read the other. This one will tell you, in fact, don't read this course, it is during the exam period you read it. This one will tell you, don't attend this lecturer's class, don't like this subject, and a lot of so many advices. But you will be the one to decide and filter advices. So in as much as you respect your senior colleagues, you should be able to think for yourself and filter advices. All right, advice that sounds somehow, please filter it, but the ones that you know that this advice is very important, please do well to take it. And the ninth one is balance reading with rest. Trust me, you are just in 200 level, you have a long way to go. I also have a long way to go, but the truth of the matter is you should learn it now, because that pressure will be there to read as a medical student, and you just keep on reading, and you see that instead of your brain is increasing but your body structure is reducing, just because you don't have adequate rest. So if currently you are a 200 level medical student who have not resumed school, probably this is your holiday, then you should have enough time to rest. That does not mean you shouldn't read. Trust me, read. If it's possible, try to read every day. Okay, but what I'm trying to say in that sense is try to strike a balance between reading and resting, because at the end of the day it is somebody who is very healthy and active that will eventually write the exam. So in as much as you want to cover a lot of things, you should also prioritize rest. Resting is also part of your studying because it actually helps your brain. The last advice I'll be giving in this video is hold God very tight. So trust me, medical school will tell you the opposite of who you are. So you might get into medical school as someone that is very brilliant. In fact, you know yourself, you know your capability, you know what you can do. But trust me, when you see your first result in medical school, you will know that it is not a joke. And so in this situation, you will be so overwhelmed. Trust me, you'll be so overwhelmed. But it is your faith in God and also the friends around you that will still keep you going. Because trust me, if you don't hold God tight and at the same time you don't have friends who are there to cheer you up, oh my God, it's not going to be a very good experience, because at the end of the day people just end up falling into depression. But trust me, with God on your side and you playing your part, trust me, medical school is something that is doable. If you enjoyed this video, do well to like, comment and hit the subscription button. As well, share to your medical student friends who will be very interested in videos like this, and you know that this video will be helpful to them. So do well to share it to them, and we meet in the next video. So do well to watch the next video, which is the part 2 of 30 advices. So as you can see in this video, I gave just 10. Then in the part 2 also, I'm also going to be giving another 10. Then conclude with the part 3, which is another 10. So catch you in the next video, guys. Bye, guys.